Dr. Hallie Sheade. I'm a licensed professional counselor here in the Dallas-Fort Worth area. I have a private practice called Equine Connections Counseling, where I practice equine-assisted counseling for clients across the lifespan, starting as young as 3 up through older adults. We also recently established a nonprofit called S.T.E.P.S with Horses, with the goal of increasing access to our services and also increasing the types of services that we can offer to better support our clients. I'm very passionate about the field of equine-assisted activities and therapies, especially the part that I do, equine-assisted counseling. To that end, I've been pretty involved with a lot of different organizations, conducted some research, and I'm in the process of writing a textbook on equine-assisted counseling.
So I'm out here with Dr. Hallie Sheade of S.T.E.P.S with Horses. Thank you very much for having me out here. I can't wait to ask you a few questions about your work.
Thank you so much for coming out here. I'm really looking forward to talking more and sharing more about what we do.
Cool. Dr. Sheade, can you talk to me a little bit more about kind of the history of equine therapy and then how you got your start in this field?
Yeah. So people partnering with horses for healing purposes dates all the way back to the ancient Greeks. So in various cultures have seen horses in different ways for healing purposes, spiritual guidance, for a very long time.
Mm-hmm.
Now, fast forwarding to more recent times, in about 50s, 60s, kind of that period of time is when different organizations and groups started popping up wanting to work with horses in a more structured way to specifically promote healing for initially people with disabilities. The Professional Association for Therapeutic Horsemanship International, which at the time was called North American Riding for the Handicapped, they've since changed their name. Now they go by PATH International. They've come up with some really great terminology to help understand the field of equine therapy. The field of equine therapy in general is so broad. There's so many people doing it, and when you hear somebody say equine therapy, sometimes it's hard to know, are they talking about therapy with treatment plans and licensed health professionals, partnering with horses to help people? Are they talking about therapeutic activities, but not what we would consider the medical definition of therapy to help people? Or are you talking about therapy for horses? When you hear the term equine therapy, nobody really knows. So PATH has done a really great job of establishing some terminology to help clarify that. They break the field up into 2 main components: equine-assisted activities and equine-assisted therapies. The equine-assisted activities tend to be the ones that you see much more on the news, popular media, movies, that sorts of thing, where you see the people with disabilities who are riding horses. And so those kinds of services, they tend to be recreational, where they don't have associated treatment plans necessarily, and they don't need to be facilitated by a licensed health professional. But they impart lots of therapeutic benefits, such as social skills, improved muscle tone, balance, self-esteem, all of these really, really great things. But the main goal is to teach horsemanship and riding and to improve somebody's wellness overall. So that's the equine-assisted activities.
Okay.
On the flip side, there's the equine-assisted therapies. And PATH defines 2 fields as being considered a therapy. One of them is hippotherapy, which that term gets confused a lot for a lot of different things that it isn't most of the time. But at its very basic definition, hippotherapy is a type of therapy that is either physical, occupational, or speech therapy that takes place on the back of a horse. So it has an associated treatment plan, movement towards specific clinical goals, and it has to be facilitated by a licensed physical, speech, or occupational therapist.
Okay.
Now, what we're here talking about today, that's the other type of equine-assisted therapy. I call it equine-assisted counseling. It goes by other names: equine-facilitated psychotherapy, equine-assisted psychotherapy, depending who you talk to. And so that's, again, what we're here talking about today. And that is mental health treatment, whether your preferred term is counseling, psychotherapy, through interaction with the horse. And so, like hippotherapy, the goal isn't to learn riding or horsemanship skills, but to meet specific, in this case, mental health treatment goals through interaction with the horse. And it has to be facilitated by a licensed mental health professional or somebody who's qualified, such as maybe a master's student intern under the supervision of a licensed professional.
Okay.
Now, as far as how I got started in the field, that goes back to when I was very, very young. Long story short, I was about 2 years old. My parents took me to a carnival with my playgroup. I was the only child that would ride the pony. Fast forward a couple years, we were moving from one town to another, and to sweeten the deal, my parents noticed there was a riding stable down the road, put me in lessons, no clue where that was going to go. I think they think it's worth it now. But I bonded with a horse named Cowman, and Cowman was known to have a pretty difficult personality to get along with, but I just felt drawn to him. And I would spend as much time as I could with him, not even riding him, just even being in the stall with him, talking to him. And we started forming a relationship, a very special relationship that even other people took note of. That this was different. This was unique. And so I became really fascinated with the human-horse relationship and trying to understand it. And horses had always been very important to me. They'd always been my source of comfort, support. Most of the good things in my life have come from horses. And so, fast forwarding through undergrad, I went on, decided to get a master's in counseling. And when I was done with that, I realized I still wanted to know more, still needed to know more. So I moved to Texas to study under Dr. Cynthia Chandler at the University of North Texas. Her specialty is animal-assisted therapy. And as I was wrapping up my doctoral program, I started my private practice, which is Equine Connections Counseling. And we've been working with people for the last 4 years, done over 4,000 individual counseling hours. And I've, in a way, come full circle. That relationship that I had with Cowman that I felt supported me, and also in some ways really seemed to have a positive impact on him, now I'm helping other people to find in a more structured way by the way that I practice psychotherapy by partnering with the horses.
Okay, cool. That's really amazing. So you got involved with horses way before you got involved with, I guess, therapy or doing therapy. So even when you were just a kid, you were doing... Do you find that that's the path that people go through, like equine therapists? They're involved with horses first, and then they get involved in therapy? Or are there some therapists that say, I've never ridden a horse in my life, I've never touched a horse, let me try this out and see?
I think it's a little bit of both. I mean, I think a lot of people that want to do it are like me. They've had this lifelong connection, or in some cases, even if they didn't have as much hands-on interaction with horses in a formal way, they've always had a fascination with horses.
Okay.
And so it's definitely a mix of people that I see wanting to get into and getting into this field.
Awesome. And I'm wondering, I'm from Texas, I'm born and raised here. Do they do things differently here in Texas than other states in terms of the equine therapy? Just from being, so I guess close to, in our history, in our, it's like almost in our blood, this kind of cowboy mentality thing.
Yeah.
Have you noticed any differences from where you used to live before here?
Yeah, I mean, Texas is definitely much more horse-saturated than anywhere else I've lived. So I think these services are a lot easier to find. But I also think there's a lot more acceptance of them than you might have in places like where I grew up outside Chicago. There are stables around where you can take riding lessons, but it's not as embedded in the culture as it is here in Texas.
Yeah.
And so I think helping people understand that connection and understanding what exactly horses can do, it's a little bit easier to swallow here.
No, for sure. Yeah, I can imagine. And I'm curious, how has the practice itself of equine therapy changed since you've been in the field?
Yeah, I've been in the field for a little over 10 years, first as a therapeutic riding instructor, so doing equine-assisted activities, and then for the last, 7 or 8 years doing what I'm doing now, more and more of it. And I think interest just continues to just go way, way up, especially for the equine-assisted counseling and psychotherapy. That piece is really, really growing. I get calls, emails from people on a pretty regular monthly, sometimes even weekly basis, wanting to know, how do I get involved in this? What training do I need to do this? And so I think interest just keeps going up.
Okay, so you're seeing interest from clients seeking out these services, and also from people who are wanting to become more involved,
Yes,
like on
both.
like a volunteer basis and things like that, even?
Therapists who are wanting to get into it themselves.
Gotcha.
So I would say those two are progressing probably about equal levels.
Yeah.
With clients wanting it and therapists, even horse people saying, how can I get into this? How can I do this? And then also it just starting to get more recognition, become more accepted in the mainstream medical community as well.
And you mentioned here that, the type of services you provide, you do need to be a licensed therapist first, I guess. What other certifications are there? I mean, is there something else you need to do to actually do equine therapy after you've become a licensed therapist?
Yeah, I mean, I would say, like with any modality that you're trying to learn as a therapist, it's important that you've had some sort of formal training, some supervised clinical experience, so been able to get supervision or at least peer consultation from somebody who's already doing it, who's already in the field. The same process you would follow for any time you're looking to implement a new modality. Now, with the horses in particular, there's different people have different philosophies. My particular philosophy is that not every therapist needs to be, an extremely experienced horse person to do it, but that they would need to partner with an equine specialist who would co-facilitate those sessions with them. And in fact, in our sessions, some of our therapists work and co-facilitate with an equine specialist. Some don't, and that really just comes down to their experience level with the horses, but also their clinical experience. So we wouldn't put a new counselor, a new therapist, someone who's fresh out of grad school doing this on their own, because there's just so much to attend to all at the same time. But I think that having a very basic, even if just a basic understanding of horse psychology, how horses think, how they operate in the world, can make the therapy be a lot more effective.
Awesome.
Because you know what your co-therapist, so to speak, the therapy animals are trying to tell you and how they're trying to respond to the client.
So I'm wondering, how can we increase access to mental health care in general, but also to specialized services like the ones you offer?
Yeah, I mean, I think there's a lot of barriers to mental health care for people in general. I think some of those barriers relate to stigma. Mental health has come a long way in trying to reduce some of those some of that stigma associated with seeking mental health care, but it's still there. And so I think just continuing to do community engagement and advocacy to help normalize, what people's experiences are that are needing some more support in the form of mental health counseling, psychotherapy, that sort of thing. But also I think mental health care can be incredibly hard for a lot of people to access for financial reasons. Sometimes, if they don't have insurance or they don't have benefits that cover mental health care, or they don't have benefits that cover the kind of mental health care they want to get, that can be a huge challenge, and a lot of the clients that we work with face those exact challenges.
And are insurances covering equine therapy?
It depends on the insurance company, depends on the provider, and in my opinion, it depends on how you practice as well. For us, we take a very psychotherapy first approach. And so if you were to boil down at the core of what we're doing, we are doing psychotherapy. We're not teaching riding, we're not teaching horsemanship. And the models that we use are very consistent, based in evidence-based practices of office-based therapies. And so I think there's a lot of factors that go into whether or not it would qualify to be covered by insurance.
Gotcha. Okay, cool. And you've developed what you call like a Steps with Horses model.
Yes.
And then also your own nonprofit to go along with that. Can you just tell me a little bit more about kind of how that got started, what it is, and what the plan is, what the big picture is?
Definitely. So I've had as I said in the introduction, I've had my private practice, Equine Connections Counseling, for the last almost 4.5 years now. And the demand has just been incredible for the services that we provide. We typically have a waiting list that almost never goes away. And we're just always trying to get in as many people as we can. The problem that we were running into, though, was a number of people on that waiting list were on the waiting list for financial reasons. They, whether they didn't fall under one of our grant categories, that when we were partnered with nonprofits, because as a for-profit we weren't eligible for most grants, or just various reasons they couldn't access our services. And so there's several reasons we established Steps with Horses, but one of the biggest ones was to increase access for clients that wanted the service, needed the service, but couldn't afford and didn't qualify for any of the funding sources that we had available. So S.T.E.P.S is a 501c3 nonprofit, which just opens up so many doors for us to apply for grant funding, to partner with other nonprofits more easily, to receive donations to help subsidize the cost of services. So that's one major reason. Now, the name S.T.E.P.S is actually an abbreviation for Spectrum of Therapeutic Equine Partnered Services. And that goes into the S.T.E.P.S model. And so in the last 5-6 years that I've been doing this, I've been noticing a trend where clients come to counseling, they meet their treatment goals, but they don't want to stop coming. They don't want to stop coming to counseling, coming to therapy, because they don't want to lose their horse connection. And when you think about it, in mental health in general, whether that's what we do or in an office-based setting, there's not a whole lot of options for people when they've met their treatment goals. There might be a group that they can go into of some sort, but generally speaking, you meet your treatment goals, you say goodbye to your therapist, and that's it. And that can be really unsettling for people, especially with some of the populations we work with who tend to have more significant mental health concerns or trauma histories. And so we established S.T.E.P.S with Horses in order to provide my my clinical term for it is a continuity of care model,
Yeah.
where somebody comes to us that's needing mental health care, so they meet their treatment goals, whether they're coming for trauma, anxiety, post-traumatic stress, whatever it may be. But then after they've met their treatment goals, after they've gotten better, we're in the process of establishing services that the goal is to then help them stay better. So these are, when we were talking about the therapeutic activities, the equine assisted activities, starting to open up and offer some of those services as well that become available to our clients once they've met their treatment goals.
Okay.
To kind of help them maintain the benefits they've already gained, let them have that horse connection without actually having to be in therapy to get it.
And is that a different set of professionals too that's offering, you know, like you're transitioning out to just the equine assisted, I guess is what you're saying? And that person may not necessarily be a licensed therapist.
Right,
they're meeting
exactly.
With as they're transitioning out.
It's still in-house, and so we have certified riding instructors, certified equine specialists that work with us, and so, you know, they're still going to be within our system, but they're going to be transitioning to these other activities. You know, and in my mind, counseling or psychotherapy can be a lifelong thing if that's what somebody needs, but it doesn't have to be.
Sure.
But horses, and getting that support from horses, that definitely can be a lifelong way of keeping yourself centered. I know for me personally, horses have always been where I go back to, and we want to help other people get that too.
So if a client was coming to see you, right, for therapy, what would the typical session with you look like?
Well, first we have 2 different kinds of equine assisted counseling that we offer, and so that is dependent on the client's age. We work with clients starting as young as 3 up through older adults. So for our 3 to about 9 or 10-year-olds, we do what we call equine partnered play therapy. And so that is actually an extension of child-centered play therapy. I'm a registered play therapist, and I was trained in child-centered. I've taken that approach and adapted it to include the horses. So we have an outdoor play area that we've set up modeled after a child-centered play therapy playroom, and we include miniature horses, or in some cases miniature donkeys, in the play therapy process.
All right. So when you're saying miniature horses, you're speaking of live animals, right? Because I've done some work with play therapists and stuff, and we talk about miniatures being that little figurines kind of thing, right? You're meaning actual miniature horses.
Actual miniature horses. And it's funny because I do have to clarify that for people on the phone sometimes to make, yes, they are alive. But they're about the size of a large dog.
Oh, wow.
And so they might only be about this tall. And so, you know, for those kids, especially when you're talking about a 3-year-old, it's going to be a little bit safer, but it's also a lot less intimidating and a lot more conducive to allowing the child to play with the toys and have that freedom of movement without worrying about them ending up underneath the horse.
Awesome. Wow, that's really, really cool.
So that's one approach. Our other approach is called Relational Equine Partnered Counseling, and we use that for older kids, teenagers, and adults. And with those clients, you know, we do our standard intake paperwork like any therapist. But from there, it can look very different for different clients. The core part of the model is that it's about the relationship that the client not only forms with the treatment team, the counselor, the equine specialist, but also the horse. And so most of those sessions take place in the pasture where there are multiple horses available for the client to choose. And we encourage the client to try to identify the horse or horses that they would like to build that relationship with.
Okay.
Just kind of, you know, the logic of the therapeutic relationship between a client and a therapist is the most important predictor of the client's success. We've extended that to the horse as well.
Okay.
And so the things that happen in the session happen through the context of that relationship, the feedback that the client is getting from the horse, and also noticing and working through the way the client sees themselves, sees others, sees their relationships through the way we see them relate to the horse.
I see. And so, you know, obviously in a place like this, it's kind of mostly outdoors. Let's say that somebody has a session scheduled and it's just a storm, you know, a thunderstorm or, you know, a tornado, something like that. Obviously not that bad, but the weather is too bad to go outside and do whatever you guys would normally do. Do you do things indoors as well?
We try our best to keep the horses involved in the session however we can. So if it's raining, honestly, some of our clients don't mind getting wet. We just put on rain gear. But if we have clients that don't want to get wet, then we may go in the barn, we may go in the arena, somewhere that's covered.
Okay.
But one of the really interesting things that I think about this approach is that there's a lot more real-world opportunities for the clients to work through and process. And so how do they respond when a bug flies right in front of their face when they're talking like the one that just did. You know, how do they handle it when plans change, when suddenly, you know, their horse is there and available, but it's raining today.
Yeah.
And so it's, you know, it's a little bit more like a real world situation.
Sure.
If that makes sense.
Yeah, I mean, that's an important part of therapy that a lot of therapists don't get to see. It's like, how do my clients respond to actual obstacles,
Right.
actual challenges
In the
live,
real world.
right? Yeah, live in the moment. And so you get to see a little bit of that
We
out
do.
here. So when they're working with the horses, I mean, are they actually on horseback, or are they on their feet, you know, next to the horses? I mean, what does it actually look like?
So in the counseling and the psychotherapy, everything takes place on the ground. There
Okay.
isn't any riding involved, and we have a couple of reasons that we do it that way. One is that the horse has a lot more freedom to respond naturally and organically. And so if a horse wants to leave a session, they can, and that can be a gold mine of processing. How does the client respond to that?
Yeah.
How does the client interpret that? But then on the flip side, what's going on with the horse? What might the horse have noticed about the client that the horse responded that way? Or is it something completely unrelated to the client? The horse walked away to go to the bathroom.
Yeah.
So that's one reason. It allows the horse to be more natural and organic in their feedback. But the second main reason is when we're in therapy, we're not wanting to really have a whole lot of role in teaching the client things or telling the client what to do. And if we put somebody on a horse, there inherently has to be more instruction just to keep them safe. Plus, if a horse wants to leave a session in the pasture, they can. They want to leave a session when somebody's riding them. That's going to look a little different.
Yeah, so the horses have their own time, its own schedule that they keep.
Yes.
Sometimes it's not.
Yeah, we joke that when we're out in the pasture, we're in the horse's living room.
That's right. Yeah, definitely. Okay, cool. And so, you know, I'm noticing here, you know, as we're looking here at these horses, they've got kind of their setups and their feed and things like that. Do the clients participate in some of that, you know, actually, you know, with buckets and things, with, you know, caring for the horses a little bit?
If they choose to. It's not something we require of them. We don't necessarily set up structured activities of, okay, today we're going to learn to groom a horse, or today we're going to learn to feed a horse. What I have noticed is that over time, a lot of our clients, and this comes up especially with our teenagers, once they've been coming for a while, once they've formed their relationship with their horse, which they tend to form pretty close bonds with their horse that they choose, then they start asking for and looking for opportunities to take care of the horse.
So they're choosing to do it.
They're choosing to do it. And it's funny, it's surprised many parents, and it will probably surprise many viewers as well, that some of these teenagers who parents cannot get to do a single chore at home will come in and ask, hey, can I pick up some manure?
Yeah.
And this isn't something we've even necessarily offered to them as something they could do. But I think what's happening is they've starting through this relationship feel that they've gotten so much from the horse that they want to find a way to feel like they're giving back to the horse.
And when you're doing something like that for something that you care about really greatly, something that's meaningful for you, it's not a chore.
Right.
You know, it's something that you're definitely more willing to do if it has that added meaning kind of behind it. So definitely. What is the typical population that you work with here?
Yeah. So our main populations, I should say, that we work with, and that S.T.E.P.S with Horses, the nonprofit, is focused on, is on providing mental health care for military veterans and their family members. So what we found is that, you know, the veterans come back and they need support, but their family members need support too. And in a lot of ways, by supporting the family members, we're actually supporting the veteran as well. So we work, again, military veterans and their families, at-risk youth, and we use that definition pretty loosely, where it could be any child that is struggling with mental health concerns that are really impairing, really getting in their way, children who don't have a support system, children whose families can't afford to access care. What's been interesting is a lot of these kids that we do work with, they might come to us with concerns of aggression, of self-harm, anxiety, depression, but the majority of the time we actually found out there's a trauma history that's going on as well that most people haven't really talked about or focused on.
Yeah, definitely.
So those are our two main groups that we focus on. But really our goal, especially with this being such a unique modality that's not easily accessible or, you know, isn't necessarily something everybody can find in their community anywhere they live, is we want to make this available to really anybody who would like to take a different approach to their mental health care. A lot of the clients that we work with tend to be people who either have refused to go to traditional office-based therapies, it's just not something they're comfortable with, or people who've tried those things and it hasn't gotten them the desired results. So the people that we tend to see most often, I would say, aside from the at-risk youth and the military, are just people who are struggling with anxiety, depression. Trauma, again, tends to be one of our specialties. Relationship problems, self-esteem, those sorts of things. Since I've been doing this kind of work, I've really noticed a lot of changes in myself and how I relate to others. As I said before, I've worked with horses almost my entire life. But it wasn't until I started doing this work and noticing how the horses respond to people in the pasture that it made me more aware of not only myself, but also other people that I'm interacting with. So when we interact with horses and when horses interact with each other, 99% of the time they're reading body language, which is a major part of human communication as well, but not one that we always attend to. And so by working with the horses, it's certainly made me much more aware of my body language and whether my body language is consistent with whatever I'm telling somebody verbally. And in addition to that, it's not only changed how I approach horses, but how I approach other people and my awareness of myself in terms of even being congruent. I always say we don't have the science to explain how horses notice what they notice and why they respond to us the way they do, but they tend to notice whether we're congruent or not. And so it's really affected my relationship with people in the sense of starting to become aware of what a horse might become aware of if they happen to be in the restaurant with me or in the classroom, wherever they might be. So I think my top tip would be for all of us, whether you're a therapist, whether you're a client, whether you're anybody else, is for us to be more like horses. Horses are great at regulating their emotions, managing their emotions. They're present, they're in the moment, and whatever they're feeling, they're always authentic and congruent. They feel something, they express it, they get it out. In fact, one of the things that I like to tell people is horses are the utmost therapist. They are warm, they're empathic, they can't lie, and they offer unconditional positive regard.